The 2020 heat season in Arizona. Today we'll be reviewing what happened with the weather, what that meant in terms of our health, and how different communities and groups around the state have been responding to the heat threat. I'll first check in with our meeting organizers that we are in fact ready to record. And we are recording. Thank you so much. So welcome everyone again. Thanks for joining us from across the state and indeed from beyond the state of Arizona. Today's webinar will review 3 different topics as we introduce them. Before we get started, we'd like to review some of our house rules for today. Our preferred audio, please advance to the next slide. Our preferred audio will be through your computer, microphone, and speaker, but there is alternate audio available through your phone. If you need any assistance from a technical perspective, please use the chat feature. There are several folks who are on hand and ready to assist you. As you heard, this webinar is being recorded and we'll have the materials and the recording available to you all shortly after the webinar ends. As you may have noticed, you've been muted upon your arrival to the meeting, and please do your best to stay muted when you are not speaking. We'll be trying to collect your questions through the chat feature. Please use the chat feature if you can. We have moderators who are archiving the questions and compiling them. They will have for our speakers after they are done. Before we get started, and to provide some welcoming remarks, I'd now like to invite Jennifer Botsford to the floor. Jennifer is the Office Chief for Environmental Health at the State Health Department, and the State Health Department is one of the backbone organizations for our regional efforts to tackle the health threats associated with heat. We, for example, are one of the few states who are grantees of the CDC's Climate and Health and Climate Ready Cities and States Initiative program. We have an Office of Climate and Health here in Arizona, and I think our Arizona team has really been leading the charge from a public health aspect with extreme heat. So Jennifer, thank you so much for joining us, and we look forward to hearing your welcoming remarks.
All right, thank you. Good afternoon, everyone. My name is Jennifer Botsford, and as you heard, I am the Acting Office Chief of the Office of Environmental Health here at the Arizona Department of Health Services. And on behalf of the Arizona Department of Health Services and our collaborators at the National Weather Service, Arizona State University, I would like to thank you for taking time out of your day to join us with this webinar. As you know, extreme heat is an important topic in Arizona. Our summertime high temperatures make news headlines every year. We know that heat-related illnesses are preventable. However, they are still affecting many people. Tackling this issue takes more than just having public health at the table. Many people throughout Arizona are doing great work to help make Arizona a safer place from the heat. We hope that the following presentation informs you about some of the impressive work members of your community are doing. We also hope to inspire future innovators and increase networking to help us better prepare for the heat. Again, thank you for joining us today, and I will turn the mic back over to David Handula.
Thank you so much. And again, we all really benefit from and appreciate the support from the State Health Department to engage in this work. As you can see, there are over 100 folks who have joined the webinar already, and we expect even more to join over the course of the next 90 minutes. We've compiled a little bit of data from the registration form just to give you all a sense of who is in the room today. In the bottom left-hand corner of the slide here, you can see the amount of participation we have by different email domains, and .gov is the leader by far. About half of the registrants for this meeting are associated with a .gov email domain representing some type of governmental organization. The remainder of the participants are relatively evenly split between the education communities, NGO advocacy communities, and other private individuals are joining us today. We are impressed by the diversity of participants that have signed up and are participating in this conversation. And as we heard from Jennifer, that diversity of engagement on this topic is a real strength and asset of work here in Arizona. Just to highlight a couple of examples of who's participating, we have retired community members who are joining us. We have emergency managers from tribal communities, high school coaches, pantry coordinator for a church, students joining us from multiple universities, meteorologists, national program coordinators, and community engagement specialists. And we'd like to especially acknowledge the several elected officials who are joining us today. As you will hear, This heat topic is one that's of great concern to a growing community, and we are particularly interested to engage with you on policy and regulatory opportunities that can help protect people in our state. So thank you all for joining us, and we look forward to hearing the wide range of opinions and ideas you have today. One of the tools we'll be using to hear from you over the course of the next hour and a half is Slido, which is one of the many online polling services that are out there. And we'd like to practice using Slido right now. We'll have the opportunity to, we'll be conducting a few polls over the course of the meeting using Slido. And to use Slido, you'll open up either on your web browser or on your phone, the website slido.com, and use the event code #HEAT. We'll be doing this after each of the presentations, and we'd like to do a practice question now. Of course, this is optional. So if I could ask the operators behind the screen to transition us over to Slido and get us started on our practice question, which is, have you ever fried an egg outside on the pavement? And we'll see as the responses come in. As we're waiting for the responses to come in, I'll mention what we're about to hear over the next hour and a half. First, we're going to hear from Paul Iniguez at the National Weather Service, a review of the weather statistics from the shockingly warm summer 2020. We'll then hear from two speakers at the State Health Department in terms of what they're seeing in the health data related to extreme heat. And then we'll transition over to hearing from two of my colleagues at ASU, who are going to be telling us about some of the solutions that we've seen implemented this summer, and in particular, some of the creative solutions that have been necessary during the time of the pandemic. I'm our moderator today. My name is Dave Hondula. I'm on the faculty here at ASU. Thank you again for joining us. It looks like we are having success using Slido. 57 folks have already responded, and we see many no's, a couple of comments. For example, somebody had the dog eat their fried egg on the sidewalk. We've also seen people melting crayons, frying something on the car hood. Why waste a good egg? A good question there. There is a reminder in the chat from Liza Kurtz, one of our team members, who is giving us some feedback there as well. And for another question that was asked in the chat, yes, we are recording. Thank you all so much. So without any further ado, it's my pleasure now to introduce Paul Iniguez from the National Weather Service Phoenix Forecast Office, who's going to provide a review of summer 2020 from a meteorological perspective. Thank you so much, Paul.
Thanks, Dave. As Dave said, my name is Paul Iniguez. I'm the Science and Operations Officer with the National Weather Service in Phoenix, and I'm going to go over some of the data, numbers, and maps of how bad our summer was, frankly, from a climate standpoint. So next slide, please. Here, depending how you define our heat season, you could say it's June through September, very broadly, maybe May to October. Here I looked at May to October, and for the entire state of Arizona, it was the hottest on record this year. Wasn't even close to number 2. It was very much a record-setting year. And if you look at the rainfall as well on the right side, that small little green bar on the right is about 1.5 inches of rain on average across the state, which was particularly bad. It was about half of the previous record low. So very clearly, this was the hottest and driest summer heat season on record for Arizona. Breaking it down on the next slide, we can kind of see how that played out through the course of the year, month by month. January was the 26th warmest on record for the state, that's since 1895. We had some areas you can see sporadic orange, which indicates that those areas were in the upper 25th percentile. February and March were fairly benign for most of the state. The ranking was 50th and 48th. It started to warm up into April, especially the very end of April. Started to see more orange and a few reds showing up there, which indicates the top 10th percentile. May was quite hot. May was the 5th hottest May on record for the state. Pretty much top 10th percentile across the entire state, and you start seeing some of those black areas showing up now. That's to indicate that that was the hottest on record for those locations. A bit of a reprieve in June where we didn't have nearly as much coverage on the red. July warmed back up, and then you can see in August, the black covering pretty much the entire state. It was the hottest August on record. Many locations had their hottest month on record. Phoenix had its hottest month on record. It ranked as #1 for the state. September, with October and November were not much different. You can see a lot of red throughout those maps, indicating top 10th percentile. We don't have an official ranking yet for November. That should be available early next week, but I imagine it will be quite high. Looking at the next slide and some of the daily temperature records, this is a question we tend to get in the weather office. You know, how many daily records do we set? And this is just a small sample from some locations across the state. And just looking at Phoenix and Tucson, interestingly, set the same number of records. So this is tying or setting a new record, either a warm high or a warm low. Both locations had 33 daily high records and 26 warm overnight low records, but quite a few records across the state. So to have this many in any given year is quite high. This is, at this point, the most daily records attributed to a single year on record for Phoenix. And looking at the next slide, kind of this questions we get as well about the number of these psychological barriers, 90 degrees, 100 degrees, 110 degree days. On the left side, you can see the orangish, actually the tan kind of hue. All those areas had at least 175 days of 90 degree temperatures or higher. In the middle, looking at the 100+ degree days, the burnt orange color there is 125 to 150, so quite extensive coverage on that. And even the 110 degree days, there's quite a few areas in there that had over 25 and over 50 days of such temperatures so far this year. And in the next chart, just looking more specifically at Phoenix, Phoenix did set a record with 145 days. Next slide, should have that. There you go. Phoenix did set a record for the number of 100 degree days this year with 145 days, which beat out the previous record of 143. And you can see the red dots are since 1950, how much we've had each year. So there's obviously an upward trend in this, and the pink bars are the decadal averages of those red dots. So there has been this upward trend, and the question, becomes, what is this going to look like going forward? And that's where the black and the gray bars come into play. These are different climate models and the projections of what they are anticipating our future climate to look like. And there's an upward trend in the number of days of 100 degrees. Putting this year into context, it would be somewhat of a typical summer in the not too far distant time, maybe 20 years or so. This could be a very usual summer. And then looking at the 110 degrees on the next slide, this was even more stark of a record set, 53 days of 110 or higher in Phoenix, which was almost double the previous record. Previous record was 33 days. And again, you see that upward projection in the climate models going forward, that what we saw this year just could be kind of a taste of what's to come in the not too distant future, certainly days that anyone on this call is likely to see. On the next slide, we have the number of days where we had heat warnings, at least in the Phoenix metropolitan area. We had 48 days of such warnings, which was a record number of heat warning days. Previously, we had 26 days, and that was just last year. On average, we had about a 4-day lead time on providing our customers, providing you folks, that there was a heat event coming up. Just looking at how that played out through the summer, again, we had a pretty early heat warning that we issued there in late April. Had a few in May. June was relatively quiet, besides just that 3-day stretch in early June. The rest of June was warning free, and we kind of saw that reflected in a previous slide. But then they started to pick up in July, and then August was just plastered with heat warnings because it was our hottest month on record. So it's not surprising that we saw so many warnings then, and they continued right into September. And if we start thinking about the impacts that go along with those heat warnings on the next slide, this is a nice data set that we were able to work with folks at the Arizona Department of Health Services and look at the percentage of emergency room visits across at least Maricopa County. How many of those visits were heat-related emergency visits? And so that's what you see here in the black and the red bars. The red bars are days when the National Weather Service had issued a heat warning. So you do see that there is a very good correlation, a good connection between those days that we had heat warnings and big spikes in the emergency room visits. So this is a nice data set for us to look at, because an emergency room visit is very much tied to a time and place. Someone gets sick, they go to the hospital, and that's going to be it. When you're looking at mortality data, it can be more delayed in there, and it's kind of hard to tie it to the individual day, but this is a much cleaner look at it. And then the chart on the right is just kind of a visualization of the ultimate outcome that can come from the extreme heat, which is a death. There's been this upward trend in Arizona. These are numbers from Arizona Department of Health Services. They'll be providing more detail coming up here. The pink bar on the far right is just an estimate at the time that I made this slide, but they'll have a final number on that. For comparison, the small black bars that you see inset are the number of tornado-related fatalities across the entire United States. So you can see in Arizona, we get we get a couple of more times the number of deaths from heat than the entire country does from tornadoes. The next slide puts the emergency room visits into a little different context. You see them color coded here, and this is based on our heat risk product that we offer everyone to look at. It's a color coded ranking system. I'll talk a little bit about this, but we have low, moderate, high, and very high days. Our office uses this to determine when and where to issue heat alerts, and we will typically issue them on days when there's high or very high heat risk. So that's a red or a magenta day. So you can see a pretty good connection between that. And then the chart on the right shows the average percent visits by category. So you can see that there's a pretty steady upward increase as the risk level from the heat risk increases. And on the next slide, just a review, if you're not familiar with the heat risk product, I strongly recommend that you check out the website, and feel free to contact me if you'd like more information on it. But it's, again, it takes our climatology and puts it into a context and gives you this color-coded framework to help make decisions. And on the next slide, just a very quick overview of how we come up with what those thresholds are. So you see the yellow, orange, red chart in the top left, and that's for any given climate station. We develop these climatological curves throughout the course of the year. This is something that we did in coordination with the CDC, actually, to try to learn those thresholds where temperatures start to have an impact on the community. We did that for 4,000 locations across the entire United States. That's what all those little red dots are. Then we took those point values and mapped them onto a high resolution gridded climate set. From there, we take our high resolution forecasts and compare them to the thresholds, the gridded thresholds, and then what you see on the right is the output, is the heat risk map. And on the next slide, you can see some nice examples of some of our partners incorporating the heat risk into their information. So we have over in California, Cal OES includes some of this into some of their dashboards and decision-making process. You see in the middle an example of an email from ADHS, which also has an inset map of the heat risk for that day. And we see some of our media partners picking up on using that as well. And in the next slide, discussing some of the media interactions that my office tends to have. It was a very busy summer on our end for engaging with the media. It's something that we routinely do, but it was quite high this year. My rough count, we probably did about 150 media interviews just on the topic of heat alone. And that ranges from our local media partners all the way up to national and international media that were interested in what was going on here, especially when you see like the tweet there where it was 99.1 degrees was the average temperature in Phoenix during the entire month of August. And it was our hottest month on record. So that garnered. And on social media, our heat stuff is popular. Just our heat related tweets garnered about 13 million impressions through the course of the summer. If you go to the next slide, question that often come up, and one that was given to us before today, was a question of why. Why was it so hot? Why was it so dry? Not to go into tremendous detail, but there are kind of three pillars that stick out for this particular season. One was just the weather pattern. The weather pattern happened to be where it was not conducive to a lot of moisture coming up out of Mexico, our typical monsoonal flow that happens. We were missed out on a lot of showers, thunderstorms, and clouds this summer. And when we don't have the thunderstorms, the showers to help cool things down, when we don't have the clouds to block out the sun, that means it gets very hot. That's why August was so darn hot, why August was the hottest on record. It just was very, very dry, with just like complete lack of that pattern setting up this year for reasons that we're still exploring. Other aspects, at least in the metro areas like Phoenix and Tucson, and in any communities really to an extent, get a heat island impact. So that's a boost in the temperatures from the built environment. And then there's the climate change aspect as well. I mean, we saw the chart at the beginning of the presentation. Temperatures across the entire state have been trending up for several decades now. It's a reality. Our temperatures are changing, the climate is changing, we are warming up. So these three come into effect. And, out of these three yellow boxes I've shown here, two of them are going to be still very much going to be in play and in place for next summer. So on the next slide, we have an outlook already for next summer for you. This is from our Climate Prediction Center. This is for June, July, August, predicting what the average temperature is going to be for the season. And right now they're putting it at about a 55% chance that we're going to be above normal, so in the upper third of the temperature of the climate range. About a 1 in 3 chance that we're near normal, and just about an 11% chance that it would actually be a below normal summer. The statistic I tend to throw out I like is that the last time Phoenix itself had a below normal summer was in 1968. So if I was making this forecast for Phoenix itself, I'd probably push it up to about 95% chance. Again, climate change and the urban heat down are both factors that are still going to be in play much for next summer. So last slide is my summary. I have my contact information on there, and I would just draw attention to the last bullet as well. My office is always very willing to work with you and your colleagues and your wherever your entities are at to help you respond and prepare for all levels of heat.
Paul, thank you so much for the excellent presentation as always. I'll note as we transition into the questions and Slido poll, Paul provided presentations for a weekly work group related to heat that many of you participated in. And in an evaluation of the work group activities, Paul's weather presentations were by far and away the most popular portion of those activities. So Paul, there's tremendous appetite for and appreciation of the office, the work that you and your office put out. So we're going to transition into another poll question now, which you can see on the screen here. The new poll question is, what is the highest temperature you've ever seen in your car when it's out in the Arizona sun in the summer? And it looks like 182 leads right now. 182 surface temperature of a dashboard, 29 responses so far. Paul, how do these numbers compare to the official all-time air temperature record that we've measured in the Phoenix area?
Definitely not the 168. I think I saw that just flash by. So thankfully it's not that one, but officially 122 is still our all-time hottest temperature. So it's still very much a challenge for us to even push 120. We see, like we saw this year, lots of 110s being encroached upon, but the 120 still takes a lot of energy to get the temperature that high.
Great, thanks, Paul. We'll continue to watch responses come in here. We have had many questions come in for you both before. Oh, sorry, one more Slido question. Thank you to our operators, and perhaps a more serious one here. Another question we have for the group today: what is the most important action that you or your institution take when the Weather Service issues a heat warning? It's really important for the Weather Service and the research community to understand the types of decisions that are being made as a result of the information they are sending out. There are survey data out there that suggest a very high percentage of the population in our region is aware of and receives the messages from the National Weather Service. And many folks do say they change their behavior in certain ways, and we are eager to hear from you individually or from your organization's perspective. Paul, thus far it looks like you're sending a lot of people inside based on early responses. Okay, as we watch these answers come in, let's take a couple questions from the chat and some that we received earlier. Paul, there was interest, you said you didn't want to go into too many details, but there was some interest in the particular weather pattern this year, if there was one, that was responsible for the high heat and what our questioner says was the no monsoon season to speak of. Can you just give us a little bit more from a meteorological perspective on what we saw?
Yeah, we're still kind of parsing through a lot of the data and trying to tease out the why. And I mean, when it comes to weather, you can always keep asking why, like a 5-year-old, and trying to backtrack and see why things played out the way they did. One thing that there was a couple of different factors that seemed like they were in play right now. One is that what we refer to as like a monsoon ridge is this high pressure, the pattern that tends to set up. You see this big anticyclonic ridge as we move into summertime. It develops over northern Mexico and intensifies and expands, and usually that cyclonic circulation around it, anticyclonic, tends to bring moist air up from Mexico, and then that feeds our showers and thunderstorms. And this year we didn't really see that. It was warm, but those heights were kind of suppressed, and they were off to the south and to the west, and so we didn't really get a lot of big push of moisture north of the international border. It kind of seems like it was stopping up in northern Mexico. And part of that was that we had a lot of weather systems that were moving through the plains down like the Front Range. So that was a lot of northerly winds that were kind of continually beating that high pressure system further south. So it didn't really get established. I mean, that's just one of like many different things that we're kind of looking at.
Thanks, Paul. Another question we have, which is related to a comment we see here on the Slido poll. One Slido poll participant says they're not currently using or sharing warning information. How can folks get more directly connected to your office to receive this information? What services do you have available?
So, one of the best ways is you can go to our website, weather.gov/Phoenix. All of our information is available on there. It's, you can click on there and get the forecast for your location. Beyond that, if you're, especially if you're like a government entity, you can work with us, and we have some alerting services that people can sign up for. We typically do that with like emergency management partners as well. So those are kind of the two main ones. If you have more questions beyond that, definitely drop me an email, and I can work with you. My office can work with you and see what we can do.
Thanks, Paul. We have a few questions about thresholds and climate normals. I'll try to combine them into one semi-coherent question that maybe you can take a chance at. One question was when we're going to see the climate normals updated. That seemed to be an important part of the heat risk product. And then a related question is, to generalize a couple of questions we've received, how does your office think about adjusting warning thresholds over time? You showed those different benchmarks in the heat risk system. How often, when, if ever, and why might those thresholds move? And is that related to updating the climate normals?
So when someone asks about climate normals, that's kind of this idea that, climate is what you expect, weather is what you get. So climate is, we look at these different 30-year periods. Right now we use 1981 through 2010 and average and smooth those out to say, here's kind of a snapshot benchmark of what we would expect the climate, like the weather, to be. Those are updated by our climate folks in Asheville, North Carolina. They do that every 10 years. So we are not yet closed out the new 30-year period. It will be 1991 to 2020. So we still have to wait for this year to finally come to an end. And then at that point, it will take them a few months to crunch all the data for the thousands and thousands of stations that they do. I would anticipate that we would see that release in sometime like middle of the year, around July. And then from that point, we'd have to incorporate it downstream into all of our other products. So kind of the tentative plan for our heat risk product would be to include that for a 2022 update. As far as changing, thresholds and where we issue warnings, we try to an extent leverage the climate, because there is certainly an aspect of, acclimatization for communities and people that live there. But in that aspect too, you also want to try to take some of the impact data. So that's why working with the CDC, that helped us establish some of the benchmarks, some of the thresholds, the bottom thresholds that we use in the heat risk product. That's not using climate normals. That's just using the health data with the climate numbers, and then what shook out of that. So I don't anticipate those would change with an update in 2022.
Thanks, Paul. And if anybody has follow-up questions to ask in the chat, please do so. We're going to throw one more Slido question up on the poll while we get another question or two in for Paul. Our third and final Slido question for this portion of the meeting is, after a record hot year, as we heard from Paul, record in many different ways, and given what we see in terms of climate trends, how are we thinking about preparing for 2021? So we look forward to seeing your answers there, as we have a couple more questions for Paul. Paul, one question, you showed a slide briefly that attributed the record to a couple of different patterns. We have a question: is there any way to identify how much of the high temperatures we saw this year is related to the urban heat island effect?
To an extent, I mean, we could tease out certainly some of that information. We can take stations that are in somewhat similar climate areas, but not necessarily within the urban environment. We do know that there is a much bigger influence on the overnight low temperatures in the urban environment than in the rural environment. During the afternoons, even in the Phoenix metro area, like the airport's is one of the hotter locations, but the Southwest Valley actually tends to see some of the hottest temperatures there. But then again, so the afternoon temperatures, the urban effect is somewhat minimal. You may be only talking about like 1 or 2 degrees. It's not really that big. The overnight temperatures, though, certainly can be on the order of like 5, 8, 10 degrees. And that's some things that we could tease out, but I would also, want to make sure to point out that there's still a lot of people that live in the urban environment. So even if you try to, adjust for it or tease that signal or whatever you want to do, I mean, still the reality is that we're experiencing those temperatures.
Great, thanks, Paul. And we'll ask our last question for you, although if there are more questions for Paul and the Weather Service that come to mind later, please do add them to the chat, and we'll do our best to get these questions compiled and answered for the meeting participants. And we're enjoying seeing some of the answers come in here. Some recommendations for air conditioning. There are some stock tips, it seems, that are coming in as well. Paul, the last question is about growing zones. Do you think that there will be updates to the growing zones again, based on what we're seeing in the climate data? Our participant says that they garden and they're trying to guess about when things should be planted and presumably what should be planted based on our changing climate. Do you have any information about how growing zones and growing calendars are revised?
I do not. As far as I know, my agency is not involved in that, besides maybe the underlying data that is used in that aspect. So unfortunately, I don't have much expertise to provide on that.
Okay, so given the short answer there, and if anybody has more insights, we'd love to hear them in the chat. We'll squeeze in one more question. Interestingly, I think there was some media coverage related to this one earlier this week, either in the New York Times or Washington Post. The question we have is, are normal temperatures increasing as increase? For example, if there are temperatures that are now above normal, will they eventually be considered normal?
Yes, the answer is yes. I mean, so again, if you think about the normal is being defined by this 30-year window that moves every 10 years. As our climate continues to warm and that 30-year window continues to slide up, it's constantly sampling warmer temperatures. So in the next update of the normals, we're going to drop off the 1980s and we're going to pick up the 2010s. And the 2010s were much warmer than the 1980s were, so that's going to push the normals up. So any place that has this continual warming trend in place, I mean, as long as that upward trend continues, the normals will continue to drift up with it. Our trends are so strong and remaining so positive. I mean, we have yet to, the normals are just not catching up because the actual weather and the climate itself is still drifting warmer.
Great. Paul, thank you so much for this excellent presentation. You've catalyzed a lot of questions in the chat that you might enjoy engaging with as we transition into the next presentation. And hopefully you saw in the Slido answers, there are a lot of folks who are consuming and making decisions based on the information office produces. So thank you for everything you do. Unfortunately, the types of weather that Paul's office has told us about and I guess not created, but at least told us about, have led to some really serious impacts for Arizonans this summer. And one of the types of impacts we're particularly concerned about is on health. And we're very fortunate to have a health department in Arizona that has heat-related impacts on their radar. We're going to now hear from two folks at the health department, Laura Fox and Matt Roach, about what they're seeing in the data in terms of what heat means for the health of Arizonans. Welcome, Laura.
Thank you, David. So I'm an epidemiologist with the Arizona Department of Health Services, and I'll be talking about the public health statistics side for the first part of this presentation. So with this record-setting year, we've just started to see preliminary data showing increases in heat-related illness and death in 2020. The ADHS Environmental Public Health Tracking Program and Climate and Health Program compile public health statistics for heat-related illness and death in the state each year. 3 data sources are used to monitor and track heat illness in the state, including hospital discharge data, syndromic surveillance, and death records. Next slide. The first data source, hospital discharge data, includes all state hospital facilities who report inpatient hospitalizations and emergency department information to the state as required by law. Hospitals report in 2 periods each year. Complete 2020 data will be available in spring 2021. To describe how hospital discharge data paints the picture of the burden of heat illness in the state, prepared here is a 5-year summary from 2015 to 2019. On average, there are 2,800 ED visits per year. The majority of ED visits are by males, adults aged 45 to 64 years old, are white non-Hispanics, and are Arizona residents. About 92% of cases occur between May and September each year. And the recorded preceding activity is either recreational or occupational in nature, and the place of injury is usually at a private residence, on a street or highway, or at industrial site. Next slide, please. Displayed here are heat-related and heat-caused illness emergency department visits over the last decade. Heat-caused emergency department visits are visits where the primary diagnosis is listed as exposure to excessive natural heat. Heat-related visits are where exposure to excessive natural heat is listed anywhere in the diagnoses and include those that were heat-caused. There has been an increasing trend since 2015 for both heat-related and heat-caused illness ED visits, and we do not have complete 2020 data available to determine if this trend persists in 2020 yet. Next slide. We also review inpatient hospitalization data where a patient stays in the hospital greater than 24 hours. Over the last 5 years, there was an average of 685 hospitalizations per year due to heat-related illness. The majority of hospitalizations are in males, adults aged 45 to 64 years old, and Arizona residents. The median length of stay is 3 days. The listed preceding activity prior to hospitalization was either recreational or occupational in nature, and the place of injury occurred at a private residence or street or highway. This was very similar to the ED visit summaries. Next slide, please. Heat illness hospitalizations have also had an increasing trend over the last decade. Next slide. ADHS has another tool to monitor heat-related illness trends during the summer months called syndromic surveillance, or our second data source for this presentation. ADHS partners with the National Syndromic Surveillance Program, CDC, local health departments, hospitals, labs, urgent care centers, and academic and private partners to monitor and track public health concerns. To explain how data is collected through syndromic surveillance, let's quickly walk through this graphic going from left to right. Patients are first seen in a medical facility like the emergency department or urgent care center. The emergency department collects daily information on each patient and submits de-identified data, including chief complaint, diagnosis codes, patient characteristics, and location to local and state health departments. Public health departments in turn submit this data to the National Syndromic Surveillance Program and CDC, which provide tools for data analytics system structure. Local and state health departments then use this data to detect, characterize, monitor, and respond to potential public health concerns and threats, such as heat-related illness, COVID-19-like illness, and influenza. Next slide, please. The National Syndromic Surveillance Program's tools detect heat-related illness visits by identifying key terms and codes within the chief complaint field or the reason for the patient's visit to the emergency department, and discharge diagnosis fields. Heat-related illness visits are displayed as a percentage of the total hospital visits by day or week and monitored for trends. This data has lots of limitations that we have to consider when we interpret the findings. And very quickly, first, that is variability may occur day to day in the capture and submission of the data. Second, not all hospitals participate in syndromic surveillance in Arizona, so visits to non-participating hospitals are not available in the dataset. At the beginning of the heat season on May 1st of this year, 68% of ED visits were captured, but by the end of the season on September 30th, approximately 87% of ED visits were being captured in the system. Third caveat is very limited data from select urgent care clinics are participating at this time. And lastly of note, the combination of COVID-19 mitigation and prevention measures, such as hospital elective surgeries being postponed from March 21st to May 1st by executive order, the data captured at the beginning of the heat season this year may not be an accurate representation of the burden of heat illness in the state. So displayed here on this slide is a time series of the percent of daily visits due to heat-related illness in Arizona emergency department facilities from May 1st to September 30th. The peaks seen on the graph for most of July and August correspond with the heat warnings issued for portions of the state by the National Weather Service. Next slide, please. To characterize the patients seen in the emergency department in 2020, with syndromic surveillance, there were approximately 3,700 ED visits due to heat-related illness from May through September, or our typical heat season. This exceeds the average of approximately 2,800 ED visits per year. And the majority of ED visits were male, young adults aged 18 to 44 years old, and non-Hispanic whites. Compared to trends in the hospital discharge emergency room averages, there seems to be an increase in the younger adults aged 18 to 44 population in 2020. And consistent with prior year trends, the majority of cases are seen in counties of Maricopa, Mojave, Pinal, Pima, and Yuma. Next slide, please. Transitioning to our last data source, we review death records collected by the Public Health Statistics Bureau or information collected from the death certificate. Data is analyzed by searching the entire record for diagnosis codes specific to heat-related illness to quantify the heat mortality burden in the state. Reviewing the last 5 years of data, there was an average of 229 deaths per year recorded, with the last 3 years exceeding 250 heat deaths annually. The majority of those deaths were male, adults aged over 45 years old, and Arizona residents. Geographically, heat deaths occur in the southern and western counties of the state, consistent with the hospitalization and syndromic surveillance data. Next slide, please. As of November 30th, preliminary 2020 heat-related death data shows there were approximately 467 heat deaths recorded in 2020 so far. This is a historical record in Arizona, surpassing all previous years heat surveillance has been conducted in the state. The majority are male, adults aged 45 years or older, and Arizona residents, and occur in the southern and western Arizona counties. It's important to note here that this pattern is consistent with prior years of data, and I'll describe this pattern in the following series of graphs. Looking at the heat-related death count trend over time, there has been an increasing trajectory since 2014, and 2020 follows this pattern. Next slide, please. Presented here is a heat-caused versus heat-related deaths in Arizona over the last decade. Heat-caused deaths are those where exposure to excessive environmental heat was listed as the underlying cause of death in the death record, whereas heat-related deaths are defined as exposure to excessive environmental heat as a contributing factor or underlying cause of death in the death record. Both heat-caused and heat-related deaths have increased over the last decade. Compared to 2019, heat-caused deaths have increased by 30% and heat-related deaths increased by 40% in 2020. This graph depicts the number of heat-related deaths by county over the last 6 years. Heat-related deaths occurred the most in Maricopa, Mojave, and Pima counties in 2020 and follows trends seen in prior years. Next graph. Displayed here are heat-related deaths in Arizona by age group, and consistent with prior years of data, 2020 heat-related deaths affected middle-aged adults, followed by older adults aged 65 years or older, then the younger adult population. Next slide, please. Reviewing race and ethnicity among heat-related deaths, preliminary 2020 data follows the same trend seen in the last 5 years. The majority of heat deaths occurred in white non-Hispanics, followed by Hispanics and Black or African Americans. Next slide, please. Over the last year, ADHS has explored other factors that may contribute to the increase in the number of heat deaths. Examining substance use, particularly drug use, the number of heat-related deaths where substance use was involved has increased since 2015. The number of heat deaths where drug use was listed as a contributing factor in the death record increased by 40% from 2019 to 2020. The pattern seen among the same population for alcohol use has plateaued in the last 5 years. Substance use in the presence of extreme heat is a public health issue, and it persists in 2020. Next slide, please. Lastly, we explored if we can extract information on heat deaths that occur indoors versus outdoors from the death record, using descriptive fields to search for outdoor key terms such as outdoor, desert, backyard, or hike. We have been able to quantify how many heat deaths have occurred outdoors versus other locations. It's important to note here that prior to 2017, the descriptive fields we examined were missing or not complete, and we're still fine-tuning our methods. However, currently 300 of the 467 heat deaths, or 64% of heat deaths in 2020, occurred outdoors. Final 2020 heat illness and death data will be available next spring and posted to the EPHT Data Explorer. My colleague Matthew Roach will now present on evaluation work conducted by ADHS in the last year.
Good afternoon, everyone. I'm Matt Roach. I'm an epidemiology program manager with the Arizona Department of Health Services and also one of the co-facilitators for this webinar. So we're gonna be trying to catch up on time, so I'm gonna go a little bit quicker through some of our evaluation slides, but I want to talk about some important interventions that have some evaluation work that we have partnered with many agencies over the past several years. One of which is the topic of cooling centers, and in public health and just in general, many people aren't aware of what these cooling centers look like. And in this picture here, you can see examples of what some of the cooling centers across the valley look like. Many of them are senior centers, nonprofits, community centers where people can go to get out of the heat. So not only do they occur in, say, the major metro areas like Maricopa County or Pima, but they also are in areas such as Yuma. So we partnered with the Yuma County Health Department to create a network of cooling centers. And here you can see a picture of some of the hydration stations where people can go to get free bottled water as well as places to cool off. And additionally, when we were in Yuma helping the Yuma County Health Department, we did a survey where we engaged with older adults through a service that did an online survey and helped us to identify where they believe that cooling centers should be located. And here you can see the existing cooling centers with the red marker, and the places where people think cooling centers should occur with the blue dots. And we see that in the blue circle in the middle of where people identified that there is a gap. So this is like one of the processes that we have used to help to better cooling center locations and try to use this type of method where cooling centers emerge throughout the state. So overall, we were asking, are cooling centers helpful for protecting vulnerable populations from the heat? And one of the things that we did in Yuma was a survey talking about one of the most vulnerable populations, people who are homeless or transient. We also spoke with cooling center managers and the older adults. So here's an example of when we were able to do our surveys down in Yuma. We also provided cooling towels, bottled water, resources for where people to get out of the heat. And also you can see a picture of our electronic survey to help us record the information. So what did we find is that the survey results for their older adults, that a little over 50% know about cooling centers, but what's really important is that we found that most people didn't know where the cooling centers were located, and about 10% had visited a cooling center. So there's work needed to be improved. With the facility managers, we found some successes and challenges. Successes, many of the facility managers reported no additional costs for operating as a cooling center. They are already doing their particular service, let's say a community center or a senior center. Most people found out about these places by word of mouth. And additionally, most of them reported that they had bilingual staff so that they could handle people who speak Spanish as well as English. So this is really important in terms of, say, signage or being able to be hospitable to people. In terms of challenges, not all of these were open all the time. They're usually only open business hours. Found the challenges that they weren't open in the evening. And some also mentioned that they ran out of bottled water during the course of the summer. So this just sums up kind of the team that went out there. We found that most of the people that were going to these centers in Yuma walked to these areas. Most of them don't have regular homes. An interesting finding is that 41% of them, so less than half, felt that their health was in danger, but 58% of the cooling center users reported that they had experienced adverse heat effects. And this graphic on the right was some of the findings and way we gave this infographic back to the cooling center managers to help them with planning for future years. So this is an example of what Maricopa County's heat relief network looks like that's run by the Maricopa Association of Governments. It shows that there is a network of cooling centers, and you're going to hear more about that network in the next presentation. A little bit more about syndromic surveillance in Pinal County. They were able to do a project with the health department there that looked at heat exposure settings and the activity, where they found that majority of the heat-related illness ED visits were people who were outdoors previously, and most of the activities that were prior to them getting heat illness was occupational related. A little bit, another project to deviate from our evaluation work, we have received numerous questions from principals and parents about recommendations for school heat safety, and something that we're working on is to develop a school heat policy recommendation and looking at thresholds. So what we have done is partner with the CDC to match school-age children emergency department visits to daily temperatures to identify thresholds for the highest risk for our children. And so one of the main things that we found was that there was increased risk found below heat warning temperatures. So here you can see the temperatures. I'll quickly explain this graph, with the red box being the highest attributable risk of when we're seeing the emergency department visits get the highest. The climate zone is representative. The basin range is kind of the Phoenix southwestern part of the state. The transition zone is the kind of higher, somewhat higher elevations. Yavapai County and the Colorado Plateau is the coldest part of our state. So what we get from this graph is that we know that the ED visits are matched up with lower temperatures than when heat warnings are occurring. So it's really important to notice that we need to start our interventions at a lower temperature. And so the graph is color coded into multiple areas to ramp us up into a tiered response, knowing that we need to do something in the early season. We need to, maybe at the beginning of the heat season, or the lowest time when the temperature increases, educate on heat-related illness. And we know that in schools that we may not need to kind of do a on-off switch and have everyone indoors. There are other interventions that we can do to help schools, such as moving recess to the earlier part of the day where it's cooler, making an acclimation period, remember to have people have the kids hydrate. So these are a few examples. And that is the end of the presentation.
Thanks so much, Laura and Matt. We really appreciate hearing those numbers from you, although of course we are not happy to hear what those numbers were. We have a new Slido poll for everyone as we compile some questions for our speakers from the State Health Department. Our first one here is, what was the most surprising statistic about heat illnesses in Arizona? And we already have 10 responses in. Matt and Laura, we have a lot of questions for you, and we'll get to just a few of them here in 5 minutes, and we'll be sure to get answers back out to everyone. I'd first like to note, for those who don't know Matt, he's the Climate and Health Program Manager at the State Health Department. And the fact that we are convened here together today is largely in part thanks to Matt's office and its hard work over the past several years. As one of the grantees from the CDC Climate Health Program, Matt and his office have been coordinating meetings like these for several years. And this 2020 heat season recap is really the next in an iteration of concepts for meetings. So Matt, we thank you for your history of commitment to this work. Let's go to some of the questions. There was a question about counts and rates. Laura, maybe you can answer this one. Just where can folks go to see the data once it's finalized? What are some different resources available from the State Health Department?
Hi, yeah, the 2020 summer heat data will be available on the EPHT Data Explorer, and we can share a link to the data chat box after I answer this question. But counts and rates and age-adjusted rates will be available once the summer 2020 data is finalized next spring. And this data is viewable in maps, graphs, charts, and tables, and can be downloaded for your personal use.
Thanks, Laura. Fantastic. A question, Matt, maybe you could take a first crack at this one. And Paul from the Weather Service, your office is called out here as well. What is the role of the State Health Department and the Weather Service in advocating for urban heat island reduction measures?
Sure, Dave, I can take a stab at that. So urban heat islands, as we know, are where the pavement and the kind of concrete jungle retains heat overnight and leads to higher overnight temperatures or later than they would be if there wasn't there. And so one of the aspects of our climate and health program is to help discuss and describe where is that occurring. And that is on one of our reports from the health department called our climate and health profile that discusses that. And I think one of the, in terms of reducing the effect, is to make people more aware and connect different agencies to a body of data. So we're a data hub for others to be able to take action related to building.
Thanks, Matt. Paul, I don't know if you care to weigh in from a Weather Service perspective there on advocacy for heat mitigation measures.
I would just say in general that, you know, my federal agency is a non-regulatory agency, and we basically have an expert advisory role. So we don't really take a stance, you know, trying to promote what people do, at least in the communities. We're very happy to provide information so that people can make more informed decisions.
Thank you, Paul. Matt, if we could go to the next Slido question while we give another one or two for you and Laura. Our other Slido question related to health data. What other types of analysis do we need to see to more fully understand the health impacts of heat in Arizona? We welcome your ideas. And speaking of analysis, we have a few questions. Laura, maybe we'll go to you first on this one about comorbidities and co-occurrence of COVID and heat illness or heat death. What do we know there? For example, how many heat deaths are COVID positive? Are we tracking that data? Will we know anything down the road? What can you tell us there?
We can certainly look at that in the future. We have not had an opportunity to look at heat deaths that among COVID-19 positive patients yet.
Okay, thank you. Well, I think I get a sense from the number of questions you have on this topic that there is appetite for that analysis once we can do it.
We'll definitely look into that. Thank you.
Thank you, Laura. All right, Matt, we'll give you the tough one. Question has come in. If extreme heat continues, what is the anticipated economic and health impact to Arizona and the Southwest? And you have about 30 seconds.
Okay, so in short, it'll be increasing, dependent on a couple factors. And so as you saw from the temperatures, kind of that trend going upwards, it can create a larger economic burden in terms of heat hospitalization costs, as well as for deaths. So we're talking about economic benefit for contribution to society. So maybe there's premature deaths where people could have contributed more time working, or maybe their relationship with having families, etc., are all impacted. But one of the complicating factors is that we have a lot of great interventions that are coming out, and we don't know the effect that these interventions will have in the future. But we're hoping is that these interventions, we know that using air conditioning is the #1 preventive strategy for preventing heat-related illness, and others can soon, that we don't know of, occur throughout the next few years, could impact and provide kind of that stabilization so that doesn't get out of control. So I'll leave it at that.
Matt, thanks. And I'll just highlight what we're seeing here is a very popular answer to this question on Slido. It looks like there's an appetite for more economic assessment of the impacts, which perhaps will enable us to make some better projections. I know we have more questions for Matt and Laura, but to try to stay close to on schedule, I'm going to move us along. We will work to get answers for the remaining questions. As a very quick one, somebody asked about connecting with the State Health Department for school heat policies. Extreme weather at azdhs.gov. Matt, maybe we could get that link in the chat. We have a number of folks on from the education community who may be interested to engage with you. Thank you so much, Matt and Laura, and hopefully our collective hard work will give you the opportunity next year to report lower case counts. And speaking of our hard work, it's a great pleasure to introduce my ASU colleagues, Melissa Guardaro and Ann Richmond, who are going to tell us a little bit about what we've seen across the state in terms of solutions and interventions. I imagine many of us were in conversations in February, March, April, when it became clear that heat and COVID were going to be intersecting hazards. I remember a very particular conversation with one city official about ramadas. What do we do with ramadas? They're a source of shade, but also a point for congregation. Should they be open or closed? And that conversation played out perhaps 1,000 or 10,000 times over this summer. And from all those conversations, I think we've seen some really exciting creativity and innovation. Melissa, thanks so much for joining us.
Well, thank you for having us. I'm going to focus on the work of the Arizona Heat Preparedness and Resilience Work Group, and I want to acknowledge the steering committee members, and that includes Paul Iniguez, Braden Kay, Dave Hondula, Liza Kurtz, and Ann Richmond, and I co-lead it. Next slide. So I'm going to go very quickly through these slides because I think that these have all been covered in the other presentations, but you can see here that it's been hot, and it got hot early, and it stayed hot. So we really need to be thinking about interventions, particularly since this year the climate was what we're predicting for models for in 2040. Next slide. And of course, this has become a public health crisis, and we don't need to belabor the point that people have unnecessarily died and also ended up in the hospital rooms. Next slide, please. And what was complicating everything this year, of course, was COVID. And I just want to review some of the closure timelines that happened. And at the end of March, all non-essential business was halted, and gyms, bars, and movie theaters were closed. And then on May 15th, it was lifted. However, we went back into lockdown, if you will, on June 29th to open in August 10th. And this next slide is if you could go to the next slide, is a graph of the COVID pandemic cases. And as you can see, in the heat of the summer, even though we were closed, there were many, many COVID cases. And one could say a contributing factor would be the fact that we were all inside during this time. Next slide.
Right, and so I'm going to be covering a little bit about kind of the logistics and what we addressed in the Arizona Heat Preparedness and Resilience Work Group. And so you can see the purpose of the group, which was really to ensure cities and counties were exposed, no pun intended, to weather data provided to us by the National Weather Service and Paul and his wealth of knowledge, but also to connect people so that they could share the different approaches to heat relief, as well as communication methods and strategies. We basically wanted to ensure that people were consistent with our group, so we had this kind of as our mantra at the beginning of each of our meetings. The work group met from April of this year on a weekly basis all the way through October, and we extended it because of the extreme heat. It met every Thursday at 3 p.m. and then after October we transitioned to monthly meetings the first Thursday of every month at 3 p.m. And so we were really excited to have a growing list of participants. And the whole purpose was really to bring together a lot of these different stakeholders that dealt with heat in different ways and tried to coordinate more of an ongoing discussion. And so as you can see, we had involvement, of course, from the state and the counties and the cities. So thank you to Matt Roach and his team for participating, the county with the public health department, so Yolza and Aaron Gettle, and many, many of the cities, which I won't list them because we're limited on time, but the greater majority of the Valley participated. So thank you very much for your participation. We had academia, which included many of the people that are on the call today, including Dave, Liza, Jenny Benos, and Paul Cosio. And then, of course, our nonprofit organizations and faith organizations. So that would included everybody from, say, for instance, the Vitalist Foundation, Salvation Army, Justice Center. We had the Nature Conservancy. We expanded into groups such as the Interfaith Network with Reverend P.D. Sexton, the 211 organization with Rebecca Stores, and of course, organizations like Chiefs by Arizona with Miss Julia. So very excited. And it was really to create an ongoing discussion regarding heat-related issues. We talked about research opportunities, shared resources, collaborative discussions, and also creating new tools, like what kinds of things do we need to provide for next year. Next slide, please. So here, in sharing our best practices, we had various presentations, and informational sessions as part of our meeting, which includes some of things like the CDC guidance for cooling centers, which was done by Shapaya. I didn't say it correct. From Dr. Sahab with the CDC. We dealt with COVID testing protocols, cooling center presentations on protocols with regards to some of the cooling centers around the states, such as in Yuma and Pinal County. So a lot of different topics were discussed in addition to the funding sources. This funding and various materials come from different places, and how those are coordinated and the need for coordination, I think, was really important. In addition, we also touched on the all-county hazard mitigation planning process and why key actions are important in being provided in that 5-year planning process. Through Melanie Gall and her work over at ASU in the Center for Homeland Security and Emergency Management, it was brought to our attention that basically heat actions aren't included in the FEMA 5-year planning process. And so the importance of providing just the action itself as a starting point can open the doors to additional FEMA funding in the future. Next slide. As you can see, some of our new alliances, which I mentioned before, also want to point out the involvement of SRP and APS in providing participation and information. It was really important to have them at the table because sometimes there are some very difficult and contentious can take place, and they are certainly important when it comes to providing electricity and different services to vulnerable populations that are impacted by heat. So very important. Next slide.
Yes, and I know this came up before about the economic costs of urban heat, and this was a topic that we visited several weeks. And I'm not going to belabor the math here, but I just want to point out that in Maricopa County in 2018, which remember, it was a much cooler year compared to this year, the total cost just for emergency room visits and for inpatient admissions was $56 million. And just think what we could do if we had 10% or 5% of that money that we could use towards mitigation and adaptation. Matt Roach and his team did a longitudinal study from 2008 to 2018 for the entire state, and this includes the cost of loss of life. And you can see that this is adding up to $17.8 billion. It's quite substantial. The Nature Conservancy is actually working on this project progress as well. I know that Anna Bettis is on this call right now, and she's got a committee together, and I suggest you contact her if you're interested in more information. Next slide. So I know that Matt showed a picture of a cooling center, and they looked really nice compared to what cooling centers needed to look like in order to be safe during the pandemic. And the first picture, although it is cropped on the left, is of the Avondale Community Center. And you can see that people were spaced apart. And we were really trying to figure out what the best practices were for maintaining a cooling center, keeping the workers there safe, and of course, keeping the visitors there safe as well. An interesting side note, Glendale, this was not about a cooling center, but rather it was about a hydration station. They opened one in a cemetery, which we thought was a very creative use of your public space. And then Tamara, I know, is on the call as well. There was the Phoenix Convention Center that was used for the unhoused, and also there were CARES Act funds that were used for providing hotel rooms for the people who are suffering homelessness too. And the middle picture is a picture of what the convention center looked like. And lastly, Tempe used a very creative example of opening up a closed public building, the Cahill Cooling Center, the Cahill Senior Center, and turned it into a cooling center for their residents. Next slide. I'm not going to go into the heat relief regional network. Tina Lopez and Brandy Mead were on the majority of our calls, but there was also a cooling center working group that met on Mondays, and we're really trying to figure out how to fine-tune the services that are offered by cooling centers and to optimize locations. Excuse me, next slide, please. And this is important because in 2019, there were 106 cooling centers. Now, I'm just talking about the indoor locations that provided air conditioning. And this served 96,000 people within a half-mile buffer. And then if you go to the next slide, you can see that in 2020, this year, we were down to 19 heat relief stations through the MAG network. And a lot of that had to do with the public buildings being closed, and it also had to do with the lack of volunteers. Many volunteers were seniors and were a very vulnerable group to COVID. But as a result, there were 82% less indoor air-conditioned centers from the year prior. And there were just 16,000 people that were served. And further, in some municipalities where there was only one cooling center, when you had your cooling center closed, then the smaller municipalities didn't have any opportunities at all. Next slide, please. So one of the projects we worked on in the Cooling Center Working Group was to optimize locations for cooling, very similar to the work that Matt had done. And instead of going with cooling centers based upon locations that have volunteered their buildings, we thought it would be good to look at the presence of elderly, people living alone, under the poverty line, non-white, less than a high school degree. And you can see the aqua dots are where the top 10 optimization locations for cooling centers. We're continuing and refining this work for the future as well. Next slide, please.
Great, and sorry about my audio problems. Hopefully you can hear me a little better now. So we, as far as lessons learned this summer, it was really important, I think, for us to understand that we have to plan for the future. So due to increasing heat extremes and longer heat periods, we really need to continue meeting and figuring out how we want to approach next heat season. In particular, there are lots of unknowns with regards to COVID and how this will continue to impact heat-related services and relief stations in 2021. So we should certainly expect, I think, for future years, the worst, more extreme, and of course, different scenarios for our vulnerable populations. And so we want to make sure that we have everybody well educated, well coordinated to come up with some workable solutions for the future. So next slide. So we're just going to touch on briefly, because I know we're really short on time, some of the interventions that have been provided by the Arizona Department of Health Services and Matt and his group. As you can see on the slide, they offer tracking programs that help monitor heat-related illnesses and deaths. The next slide is they also offer emergency preparedness plans. Many of the health departments in Arizona have extreme heat emergency preparedness plans, so these are very, very important. Next slide. Also, they've been very active in distributing heat safety materials to outdoor and drive-up testing sites for COVID. And I believe this was one of the ideas that actually came out of the work group through Matt and his discussion with the various stakeholders. And so they were able to distribute more than 5,000 brochures in 1 week, which was amazing to help educate those that are attending those testing sites throughout the valley. Next slide. Here you have another couple pictures with regards to COVID testing and heat and kind of combining those messages. Next slide. As well as using social media and websites to disseminate information. So having heat warning alert banners provided. There are also other organizations that have provided that in conjunction with COVID warnings and information. Next slide. There's also the Maricopa County heat page. Other organizations such as Phoenix, the City of Phoenix and Pima County also have information available that talk about how to prevent, recognize, and treat heat-related illnesses, which are very important. Next slide. We also have heat alerts, which, by the way, if you have not signed up for this, we highly encourage this. You can do so at azhealth.gov/heat. And so as you can see, there are quite a few thousands and thousands of subscribers. So This is a very important way of getting information out to the public. And of course, today's heat meeting, it's my understanding the annual state heat planning workshop has been going on for 7 years. And of course, it's an in-person function. This year's a little different because of COVID. So I'm glad that we were able to certainly continue meeting remotely so that we can continue that particular workshop process. Next slide. And DHS has been helpful in raising awareness for Arizona Heat Awareness Week, which takes place in May every year. Next slide.
Yeah, so the other lessons that we learned, sorry about that, I just realized I was muted. The other lessons that we learned this summer were about increasing and optimizing locations for cooling centers. And we really feel like we need to do a point-in-time data collection to understand why people are using them, who is using them, was there something going on in their life that they necessarily needed to come to a cooling center. And then we really have tried to energize networks for additional cooling center locations. A big shout out to the Interfaith Network that has stepped up and made this part of their plan next summer to use some of their space. And this was especially important when other buildings were closed and a lot of religious places had buildings and campuses that were being unused as well. And then we're going to data to determine optimal locations, and that was that optimization plan that I talked about earlier. And then another idea that has been talked about is instead of having two ideas, either the cooling center is open or it's closed, could have different levels of cooling centers where some are open only in the late afternoon and evenings where there's great demand and hardly any of them are opened at those hours. And then maybe some other ones would be open only during peak heat morning or heat watch days. And lastly, to assist with the supplying of cooling centers, because the Interfaith Network was really willing to step up, but they said, I want you to understand that we're willing to give our building, but we are going to face increased costs with having to have water and PPE. So we are now developing right now the Cooling Center Response Network platform, which will act as a sharing platform for people who want to provide materials for cooling centers, and then for cooling centers that want to open and then they need supplies as well. So that's really exciting. And then last but not least, and leading into what we heard was that it's very expensive to run air conditioning, particularly in big buildings. And this could cost upwards of $1,000 a month. So we are investigating utility assistance programs for cooling center providers along the way. So this is just a few of the examples, and I've left out so many other great examples from our group and certainly things that are going on around the county and state. And if you have any questions or if you want to be part of this working group, please contact myself or Anne or Liza. I know left her contact information in the chat as well. Thank you.
Anne and Melissa, thank you so much for giving us a little optimism that there is positive work happening. And Melissa, as you mentioned, we're sure the slides here didn't cover all of the successes that we heard this year. Matt, if we could go to the previous question. Thank you. So we'd love to hear from you all about other successful heat interventions happening around the state. We heard a list there from Melissa and Ann, but what else is happening out there that needs to be on the radar of the health departments that's ultimately working to protect people? We'd love to hear other ideas and other initiatives that you know are in action. We have had some questions come in for you, Ann and Melissa. There was a question, Melissa, maybe we can send this one your way, about water fountains. There's a recommendation that we need more water fountains. I know you were involved in a little bit of research here. What's happening with water fountains, at least in the Phoenix area?
So in the Phoenix area, there are public water fountains that are maintained by the city. And actually, this would be a good question for somebody in Public Works or Parks Department to jump into. And during this past summer, we actually wanted to map all of the water fountains that were available. And You know, water fountains are very expensive, and perhaps there's already a network of businesses that would provide water at no cost to people. So there are several apps that can do that. TAP, T-A-P, is one that can do that. And the city of Tempe actually has the map of their water fountains available for the public. So water is one of those things that the research that we've done with residents, they want to have easy access to water, and preferably cold water too. And it's something that we definitely are looking more into.
Thanks, Melissa. Your presentation talked about cooling centers. There's another question related to hydration drives. What did you all see in terms of how COVID and hydration drives were impacting one another? And we'll go to you, Melissa, first for that one, and maybe Matt wants to respond as well.
Well, it was really funny because the water numbers were down, water collection numbers were down because many of the businesses that do collect the water were not open. And when we really needed them, there were also people who were hesitant to come out for the drives. There were examples of organizations that collected unbelievable amounts of water, but this cooling center response network is something that we really want to get up and running, so that then when you need water, you would be able to request that, and organizations that have too much water, which we actually heard of one organization having too much water, would be able to share it along the way.
Matt, is there anything you'd like to add from the State Health Department perspective?
Just from hearing from some of the different cooling centers and city partners, I remember hearing that the heat kind of hit us early in April, and the overall maps that you saw presented weren't really ready at that time. And I think with a combination of the shutdown, it led to a lack of availability for places for people to donate during the beginning of the summer. And I think that was one of the things that overall impacted the availability throughout the summer.
Matt, thanks. And we've got some nice comments coming in the chat about different strategies and quantities related to water that were coming in. Okay, we have a question here. Melissa, you touched on this. Just wondering if you, and I know you don't want to speak for the utility companies, but there's a question about how utility companies or charities might be providing a way for individuals to donate to help those who are struggling with utility bills. The problem, as this participant understands it, is that utility assistance programs often run out of money while there's still a great deal of need. What are you aware of from a research perspective in terms of what's happening with utility bills, assistance, and meeting some of the shortfalls?
I am just peripherally involved in this, so maybe there's somebody else in the call that would be more able to answer this. But as everybody knows, there's been a moratorium on disconnections, but that doesn't mean that there's been a moratorium on fees. So people will have to pay back the money, and you can be on a payment program. That's one part of it. That, these heat deaths that we had were despite having a moratorium on evictions and disconnections. So you have to think what it would be like if both of those programs were up and running. And as for a utility assistance program, I've heard anywhere from a range of the number of people who qualify, and there are very specific criteria for you to qualify. The number of qualified people that get the services range between 5 and 10% of those that request it. So you can see there's a lot of need, and this program is certainly not reaching everybody who is requesting it.
Thanks, Melissa. Matt, why don't we transition to the last Slido question? And our last Slido question is really soliciting recommendations and ideas. What do we need to be thinking about looking forward, the collective we, looking forward to 2021 for reducing heat illness? So we look forward to seeing your ideas there. We have a few more questions that have come in. Laura, we actually have a question that came in for you. You presented some information about heat-related deaths and substance abuse, and there was an interest in diving in a little bit deeper to those data. In particular, what do we know about individuals experiencing homelessness and how they might fall into the heat death substance abuse story that you were telling? Do we have any information there from the State Health Department?
Unfortunately, no, not at this time. initial queries last year, looking at it, I have not been able to pull a significant amount of homeless information or factors from the death records. I will try to do another search again for the 2020 data, but right now we don't have any statistics on that information.
This sounds like it could be a promising area for collaboration with some of the organizations that are particularly focused on serving that population. You know, my sense is that often the records, and Laura, I guess a follow-up question, often the records for unsheltered individuals that your office might receive will be somewhat to very incomplete, well, which could make an understanding of this portion of the problem quite difficult. Do you see that as a barrier, data incompleteness?
Yes, definitely.
Okay, well, some work to do there. Just looking through the chat here, if you have another question or two, we're nearing the end, but we do have a time for just perhaps one or two more questions. Melissa, there is a question. We've seen some comments here on Slido as well. Is there anything happening on the role that trees can play in helping to mitigate the impact of rising temperatures on people?
We have a ton of information on what trees can do to mitigate the impact. And I think that there is also an equity issue that I'm surprised hasn't ended up in any of these Slido polls. And certainly when you see percent of greenness in an area, the more wealthy areas have the flood irrigation, the mature trees that provide a lot of shade, and it becomes lesser so in more vulnerable neighborhoods. So I think not only do we know that trees provide shade and thermal comfort for people, it also becomes something that is an equity issue as well. There was also something in the chat about joining the work group. The Thursday work group, which is for anybody who is interested in Arizona heat preparedness and resilience, is open to anyone who wants to join. Just send any of us an email. This is a big tent and it's a big problem, and there is space for everybody to help solve it. There is a smaller working group specifically for cooling centers, and if you would like to lend a hand there, we certainly could use your help there as well.
Thanks so much, Melissa. Just grab a couple of comments that are in the chat. There are some questions and recommendations, and I'll pose them both as challenges to our group to continue to think about. One question was about advertising for cooling centers and other services for the people who don't have internet access. That even appeared earlier in the chat. I think that's a challenge for us all to think about. And one additional comment is that we've heard a lot about adaptation measures for heat. We haven't heard so much today about what we're doing from a regional perspective on greenhouse gas emissions. There certainly are other forums where that conversation is happening, including the ongoing work in the city of Phoenix for their climate action plan. But I think there is an opportunity to bring together these conversations. It is 3:30, so I'd like to thank all of our speakers for all the hard work they put into sharing this information with us, and everyone for attending. At some point, we were all the way up to something like 125 participants today, I think, speaking to the wide breadth of interest in this topic. As we heard from Melissa and Ann, there are plenty of opportunities to remain engaged. The next one on the calendar would be next Wednesday, when Vilsa Barisha from the Maricopa County Department of Public Health will convene the next meeting of the Bridging Climate Change and Public Health Initiative for Maricopa County. And Matt and his team are thinking hard about what we might be able to do in the spring for a pre-season meeting. Of course, Matt and his team are also involved in helping respond to COVID and get the vaccine out, so they are busy, but we are hopeful we will be able to convene in one form or another in the spring. With that, I'd like to thank you again for all of your time for participating. We'll certainly stay on the line after the meeting ends for some informal conversation for those who are interested. But otherwise, have a good day, stay safe, and we'll see you soon. Thank you. And with that, Matt, I think we can stop the recording.